In this series, we're going to look at an overview of joint examination. What's important to know is the surface anatomy of the area that you're dealing with, so you can understand the structures being affected. It's important to have a good understanding of the pathology of various different diseases and illnesses that may affect these joints. The basic principle is look, feel, and move. So when we examine the patient, we look for symmetry. We look for differences between the right and left-hand side of the body. We look for any signs of swelling, whether this is diffuse or generalized, and we look for any discoloration. This may be due to bruising, erythema or redness, or may be due to perfusion type problems, where the area may be pale and dusky or even cyanosed. The local muscles will give us indication of how long-standing the injury is, and any signs of atrophy or muscle wasting can indicate a chronic condition associated with disuse or a nerve injury. We examine the area looking for any sort of bony deformity. This can be due to congenital problems, arthritises, old fractures, or dislocations. We look for the presence of any scars indicating previous trauma or previous surgical operations. After we look at the area, we move on to palpation, and we palpate an area looking for changes in temperature. Increased temperature being associated with inflammation and infection, and reduced temperature being associated with disuse or possible perfusion and vascular problems. We palpate the area feeling for tenderness. The patient describes pain, but when we elicit a painful response, this is called a tender area. When we're palpating the area, we're also palpating for any crepitus or any other abnormalities. We then go to movement, and when we test movement, we check for active movement, passive movement, and resisted movement. It's very important to compare the two sides of the body, as each person's strength and range of movement is individual to them. When we assess power in resisted movement, we give it a grading system out of 5. Some joints may be fixed. This may be due to chronic infection, arthritic changes, or surgical fixation, such as an arthrodesis. We also see if there's any paralysis of the area involved. When we assess the range of movement, we assess for power and also the degree of movement. It's important to document the degree of movement in your notes, as subtle improvements or deteriorations can be important for the patient's clinical condition. Finally, we move on to specialized tests, and they depend on the joint involved. This can involve checking ligaments or doing specialized tests to isolate individual muscles, where the movements are normally composite movements.